Millions of adults over 60 take blood pressure medication every single day, trusting it's protecting their health. And in many cases, it does. But what often goes unnoticed is that certain commonly used medications, especially when combined, may be quietly placing stress on the kidneys over time. Now here's what makes this concerning. This isn't something you feel right away. There's no clear warning sign, no obvious symptom. In fact, kidney stress can begin silently, long before anything feels wrong. And that's exactly why so many people never see it coming. Now, building on that, this is where the bigger picture starts to come into focus. Because the impact of all this becomes much more meaningful after the age of 60. As we get older, the body doesn't operate in quite the same way it once did. And that includes the kidneys. Even in otherwise healthy individuals, kidney function tends to decline gradually over time. It's a natural part of aging, not necessarily a disease, but it does change how the body handles stress. What this really means is that the margin for balance becomes smaller. In younger years, the kidneys often have more reserve capacity. They can handle fluctuations, process medications efficiently, and recover more easily from strain. But over time, that buffer slowly narrows. And this is where it gets important. Medications that are generally considered safe and effective can begin to behave differently in an older body. Not because the medication itself has changed, but because the way the body processes it has changed. To understand this better, think of it like this. The same dose, the same routine, the same treatment, but a system that is now slightly more sensitive to its effects. And this becomes a problem when that difference isn't fully recognized. What this really means is that treatment approaches that once worked smoothly may now require closer monitoring, small adjustments, or simply more awareness as the body evolves with age. But here's where most people get caught off guard. There's a very common assumption. If there are no symptoms, then everything must be fine. And on the surface, that feels logical. No pain, no discomfort, no visible changes. But when it comes to kidney function, that assumption can be misleading. Because in many cases, changes can be happening quietly, without any obvious signal to alert you. And this is important because it can delay awareness, not out of neglect, but simply because there's nothing noticeable prompting a second look. So the question becomes, if the body isn't sending clear signals, how do these changes actually develop beneath the surface? To answer that, we need to look a little deeper at the mechanisms involved and how certain combinations can gradually influence kidney function over time. Now, to really understand how this connects, we need to look at what these medications are actually doing inside the body. Blood pressure medications are designed to reduce strain on the heart and blood vessels. They help relax blood vessels, lower pressure, and improve overall circulation. And in many ways, that's exactly what the body needs, especially when blood pressure has been high for a long time. But here's where it gets a bit more complex. Some of these same medications don't just act on the heart and arteries. They also influence how the kidneys function. What this really means is that they can affect how the kidneys filter blood, how they regulate fluid levels, and how they maintain the internal pressure needed to do their job properly. Now, here's where it gets important. The kidneys aren't just passive filters. They rely on a very precise internal balance to work efficiently. Blood needs to flow through them at the right pressure. Fluid levels need to stay stable. And inside the tiny filtering units, pressure must remain within a narrow range for proper filtration to happen. Let's break this down step by step. First, blood flow. The kidneys depend on a steady, well-regulated supply of blood. Too much pressure can damage them over time, but too little pressure can reduce their ability to filter waste effectively. Second, fluid levels. The body constantly adjusts how much water to retain or release, and the kidneys are central to that process. Certain medications can shift this balance, sometimes subtly. And third, internal pressure within the filtering units. This is a more hidden mechanism, but it's critical. The kidneys use this pressure to push waste products out of the blood and into urine. Now, building on that, each of these systems can usually handle small changes on their own. A slight adjustment in blood flow? The body compensates. A mild shift in fluid levels? The kidneys adapt. But this becomes a problem when multiple medications are influencing these systems at the same time, because their effects can begin to overlap. One medication might reduce blood flow slightly. Another might alter fluid balance. A third might change internal pressure within the filtering units. Individually, these effects may be manageable, but together they can place additional strain on the kidneys, especially over time. And this is important because the kidneys rely on balance, not extremes. When that balance is disrupted in more than one way, even subtly, the overall workload on the kidneys can increase. And again, this doesn't usually happen in a dramatic or obvious way. It's gradual, quiet, easy to overlook. Which brings us to the next important question. If this process is happening slowly in the background, why is it so rarely noticed early on? To really make sense of this, it helps to focus on a few key contributors, starting with one of the most commonly used types of blood pressure medication: diuretics. These are often prescribed to help the body remove excess sodium and water. By doing that, they reduce the volume of fluid in the bloodstream, which helps lower blood pressure. For many older adults, they can be very effective and play an important role in maintaining cardiovascular health. Now, building on that, this process depends on something that often gets overlooked: adequate hydration. Because while diuretics are helping the body release excess fluid, the system still needs enough water to maintain balance. And this is where it gets important. As people age, the body's natural thirst signals can become less reliable. Many older adults simply don't feel as thirsty as they used to. On top of that, daily routines, habits, or even concerns about frequent urination can lead to unintentionally drinking less fluid than the body actually needs. What this really means is that fluid levels can gradually drop lower than expected, without it being obvious. And this is where the effect begins to shift. When fluid levels fall too low, the kidneys are forced to work under different conditions. Instead of filtering blood in a well-balanced environment, they begin working with more concentrated blood. Let's break that down. With less fluid available, waste products become more concentrated, and the kidneys have to work harder to process and eliminate them. At the same time, the internal structures responsible for filtration may experience increased pressure and strain. Individually, this might not cause immediate issues, but over time, this subtle imbalance can begin to add up. And this is important because the kidneys rely on consistency. When they're repeatedly working in a slightly dehydrated state, even if it's mild, it can gradually affect how efficiently they filter waste from the body. Again, this isn't something that happens suddenly. It develops slowly, quietly, and often without any clear symptoms. And that's what makes it so easy to overlook, until the effects have already begun to build beneath the surface. Now, this is just one part of the picture, because when diuretics are combined with other medications that influence blood flow and internal pressure, the overall impact on the kidneys can become even more complex. Now, building on that, the second contributor is something many people are already familiar with: ACE inhibitors. These medications are widely used to help relax blood vessels and reduce overall blood pressure. For many individuals, they're well tolerated and play an important role in protecting the heart and circulation. But to understand how they connect to kidney function, we need to look a little deeper at how the kidneys actually filter blood. The kidneys rely on a very specific level of internal pressure to do their job effectively. Inside each kidney are tiny filtering units that depend on steady blood flow and just the right amount of pressure to push waste products out of the bloodstream. What this really means is that filtration isn't just about blood arriving, it's about how it moves through the system. Now, here's where it gets important. ACE inhibitors work by lowering pressure within the blood vessels. And while that's beneficial for reducing overall strain on the body, it can also influence the pressure inside those delicate filtering units in the kidneys. In most cases, the body adapts well to this change. But in some individuals, especially those with narrowed arteries leading to the kidneys, the situation can be a bit different. To understand this better, imagine the blood supply to the kidneys is already slightly restricted. When overall pressure is reduced further, the amount of blood reaching the kidneys can drop more than expected. And this becomes a problem when that reduced flow starts to affect filtration. With less pressure pushing blood through the filtering units, the kidneys may not be able to process waste as efficiently. Filtration slows down, not because the kidneys have suddenly failed, but because the conditions they rely on have shifted. And this is where most people get caught off guard. There are often no clear symptoms, no discomfort, no immediate signal that anything has changed. Everything can feel completely normal, even while filtration efficiency is gradually decreasing. And that's what makes this so important. Because without routine monitoring or testing, these changes can easily go unnoticed. Now, on its own, this effect may be manageable and even expected in certain cases. But when combined with other medications that influence fluid levels or blood flow, the overall balance within the kidneys can become even more sensitive. And that brings us to the third piece of the puzzle. Now, building on that, the third contributor is something many people don't even think of as part of the same picture, and that's common pain relief medications known as NSAIDs. These are widely used for joint pain, headaches, or general inflammation. In fact, because they're often available over the counter, many people take them regularly without giving it much thought. They feel familiar, accessible, and generally safe when used as directed. But here's where it gets important. These medications work by reducing certain substances in the body that are involved in inflammation. And while that helps relieve pain, those same substances also play a role in maintaining healthy blood flow within the kidneys. What this really means is that when those substances are reduced, the blood vessels inside the kidneys can begin to narrow slightly. Let's break that down. The kidneys rely on steady, well-regulated blood flow to function properly. When the blood vessels constrict, less blood reaches the tiny filtering units responsible for clearing waste from the body. On their own, this effect is often temporary. The body can usually adjust, and kidney function returns to its normal balance once the medication is no longer active. But this becomes a problem when NSAIDs are used alongside other medications that are already influencing kidney function. Because now, you're looking at multiple effects happening at the same time. One medication may be reducing fluid levels. Another may be lowering internal pressure. And now, This one is slightly reducing blood flow into the kidneys. Individually, each effect might be manageable, but together they begin to overlap. And this is important because the kidneys depend on balance. When blood flow is reduced, pressure is lowered, and fluid levels are shifted all at once, the overall strain on the filtering system can increase, especially over time. And just like the other contributors we've talked about, this doesn't usually create immediate, noticeable symptoms. There's no clear signal that something is off, which is exactly why this combination can quietly affect kidney function in the background, without drawing attention to itself. And this leads to a deeper question. If all of these effects can happen subtly and without obvious warning, why is it so easy for this pattern to go completely unnoticed for so long? Now, when you bring all of this together, a very important pattern begins to emerge. Individually, each of these medications can serve a clear purpose. Diuretics help manage fluid levels. ACE inhibitors support healthy blood pressure. NSAIDs provide relief from pain and inflammation. But what this really means is that each one is influencing a different part of the same system, the kidneys. And this is where it gets important. When these effects begin to overlap, the kidneys are no longer adjusting to just one change at a time. They're dealing with multiple shifts happening simultaneously. Let's break that down step by step. With diuretics, fluid volume may be reduced. With ACE inhibitors, the internal pressure needed for filtration may be lowered. And with NSAIDs, blood flow into the kidneys may be slightly restricted. Now, building on that, each of these changes on its own might be manageable. The body has ways to compensate when only one variable is slightly altered. But this becomes a problem when all three are happening together, because now the kidneys are trying to function with less fluid, lower pressure, and reduced blood flow, all at the same time. And this is important because the kidneys rely on balance across all three of those areas. When that balance is disrupted in multiple ways, the overall workload and stress on the filtering system can increase. In medical settings, this kind of overlap is recognized as a higher-risk interaction pattern. Not because any one medication is necessarily inappropriate, but because their combined effects require more careful attention. Here's the key idea. Each medication on its own may be completely reasonable and even beneficial. But when used together, especially over time, they can place the kidneys in a more vulnerable position. And once again, this doesn't usually come with obvious warning signs. There's no immediate signal telling you that the system is under strain, which is exactly why awareness becomes so important. Because without it, this kind of pattern can continue quietly in the background. So the next question is, if this overlap can develop gradually and silently, why is it so rarely noticed until much later? Now, to really understand why this matters, we need to look a little deeper at what's happening beneath the surface, because the kidneys are far more delicate than most people realize. Inside each kidney are millions of tiny filtering structures. These are responsible for continuously cleaning the blood, removing waste, and maintaining the body's internal balance. But for these filters to work properly, they depend on very specific conditions: stable blood flow, adequate hydration, and the right level of internal pressure. What this really means is that the kidneys are constantly balancing multiple factors at once, every second of the day. Now, here's where it gets important. When hydration levels drop, even slightly, the entire filtering process becomes less efficient. The blood becomes more concentrated, and the kidneys have to work harder to separate waste from the fluid that's available. And this becomes a problem when that state repeats over time. Because instead of working in a well-balanced environment, the kidneys are consistently operating under slightly strained conditions. Now, building on that, let's look at blood flow. The kidneys require a steady supply of oxygen and nutrients to keep those filtering structures functioning properly. When blood flow is reduced, even subtly, less oxygen reaches the tissue. What this really means is that the cells responsible for filtration don't perform at their best. Not enough to cause immediate symptoms, but enough to gradually affect efficiency over time. And then there's internal pressure. This is one of the more hidden mechanisms, but it's critical. The kidneys rely on a certain level of pressure inside those filtering units to push waste products out of the bloodstream. When that pressure drops too much, the entire process slows down. Waste removal becomes less effective, not suddenly, but gradually. And this is where all of these factors begin to connect. Lower hydration, reduced blood flow, decreased internal pressure. Each one influences a different part of the same system. Individually, the kidneys can often adapt, but together, they begin to shift the way the kidneys perform over time. And this is important because none of these changes cause pain. There's no immediate discomfort, no sharp signal that something is wrong. Instead, what happens is a slow, quiet change in performance, a gradual reduction in how efficiently the kidneys do their job. And because it happens so subtly, it can continue unnoticed until it reaches a point where it becomes much harder to ignore. Now, bringing everything together, the most important part of this discussion is not fear. It's awareness that leads to practical, steady habits in daily life. One of the simplest but most effective steps is keeping an updated list of everything you take. That includes prescriptions, over-the-counter pain relievers, and even supplements. What this really means is that no single medication exists in isolation. So having the full picture helps healthcare providers understand how everything is working together in your body. Now, building on that, it's also important to bring kidney function into regular conversations during routine checkups. Not only when something feels wrong, but as part of ongoing care. Simple blood tests over time can give early insight into how well the kidneys are handling the body's demands. And this is where it becomes especially meaningful. Instead of focusing only on treatment, the focus shifts toward monitoring and prevention. Because kidney changes often develop slowly, regular checks can help identify small shifts long before they become serious. Another key point is learning to think about medications in combination, not just individually. A medicine might be safe on its own, but its overall effect can change when paired with others. What this really means is that the interaction between medications matters just as much as each one separately. And this is important because it changes the kind of questions you ask. Instead of only asking, "What does this medicine do?" it becomes more useful to ask, "How does this work with everything else I'm taking?" Or, "Should anything be monitored more closely because of this combination?" Now, here's a very important reminder. Medication changes should never be made independently. Even well-intentioned adjustments can have unintended effects when it comes to blood pressure, fluid balance, or kidney function. So any changes should always be guided by a healthcare professional who understands the full picture. What this really means is that safety doesn't come from stopping or starting things on your own. It comes from informed decisions made with proper guidance. And when you step back and look at all of this together, the main idea becomes very clear. Small, consistent awareness, keeping track, asking questions, and doing regular checkups can make a meaningful difference over time. Not by creating worry, but by giving you a clearer understanding of how your body is functioning beneath the surface. And that awareness, over the long run, is often what helps protect kidney health most effectively. Now, stepping back from all the details, the main message becomes much clearer and more grounded. Blood pressure control remains one of the most important pillars of long-term health. It helps protect the heart, supports circulation, and reduces the risk of serious complications over time. At the same time, what this really means is that understanding how treatments interact with the body adds an extra layer of protection, not to replace medical care, but to support it more effectively. The key takeaway is not to avoid medication. These treatments play a vital role in managing health and preventing more serious problems. Instead, the focus is on using them with awareness, regular monitoring, and a clearer understanding of how the body may change over time. Because kidney health, in many cases, depends on what's happening quietly in the background. Not always in obvious ways, and not always with immediate signals, but through gradual processes that unfold slowly. And this is where staying informed makes a real difference. When there is awareness of how different factors connect, medications, hydration, blood flow, and internal balance, it becomes easier to support the body in a stable and consistent way over the long term. Not through drastic changes, but through steady attention and regular care. And ultimately, that's the most important idea to hold on to. When you understand what's happening beneath the surface, you're in a much better position to help those silent processes remain stable for years to come.